What is telehealth psychology? Telehealth psychology provides psychological support through secure video or phone appointments. Access support from home, reduce travel and distance barriers. Use secure digital platforms. Involve a support person with consent. Receive practical strategies and resources. Attend from a private and familiar environment. How does telehealth psychology work? The process is simple and tailored to each participant's needs. Make an initial inquiry. Complete intake and consent forms. Discuss whether telehealth is suitable. Confirm fees and funding arrangements. Receive a secure appointment link. Join the session from a private location. Review goals and progress over time. Telehealth psychology process at a glance. Telehealth psychology follows a clear process to ensure support is suitable, safe, and tailored to each participant. Make an initial inquiry. Complete intake and share relevant goals. Review whether telehealth is appropriate. Confirm fees, consent, and privacy. Book the appointment and receive a secure link. Attend the first session. Set support goals. Continue sessions and review progress regularly. What happens? During a telehealth session, each telehealth session focuses on the participant's needs, goals, and communication preferences. Discuss current concerns and experiences. Review progress towards agreed goals. Explore thoughts, feelings, and behaviors. Practice coping or communication strategies. Build problem-solving and daily living skills. Agree on practical steps before the next appointment. What to expect at first telehealth psychology appointment. The first appointment helps the psychologist understand the participant's strengths, needs, preferences, and goals. Discuss interests and current concerns. Review disability-related and functional needs. Talk about daily routines and support networks. Identify communication preferences. Review previous services and NDIS goals. Ask about experience, privacy, and reports. Decide whether the psychologist and telehealth format feel suitable. How telehealth psychology support NDIS participants. Telehealth psychology may help NDIS participants build skills, confidence, and independence in everyday life. Develop emotional regulation and coping skills. Improve communication and decision-making. Build confidence in daily activities. Strengthen relationships and social participation. Support greater independence at home and in the community. Help families understand disability-related needs. Choose telehealth psychology support that reflects the participant's communication needs, daily challenges, and NDIS goals. Can the NDIS fund telehealth psychology? The NDIS may fund telehealth psychology when it relates to disability needs, NDIS goals, and available plan funding. Check the approved plan, confirm the funding category. Link support to functional needs. Review fees before booking. Confirm funding with the plan manager, support coordinator, provider, or NDIA funding is not automatic. How are telehealth psychology services claimed? Telehealth psychology is claimed using the relevant NDIS support item based on how the participant's plan is managed. Agency managed. Provider claims through the NDIS system. Plan managed. Provider invoices the plan manager, self-managed. Participant arranges payment and claiming. Confirm hourly fees and report costs. Review cancellation and non-face-to-face charges. Check the current NDIS pricing arrangements before services begin. NDIS, Medicare and private telehealth psychology. Telehealth psychology can be accessed through different funding pathways, each with its own purpose and requirements. NDIS, disability-related capacity building and functional support. Medicare, eligible mental health treatment with referral requirements. Private payment, the person pays the provider directly. Private health insurance, rebates depend on the policy. Confirm eligibility, fees and referrals before booking. NDIS and Medicare cannot pay for the same service. Who may benefit from telehealth psychology? Telehealth psychology may suit people who face barriers to attending appointments in person. People in regional or remote areas. Participants with mobility or transport difficulties. People with limited local psychology services. Families needing flexible appointment options. Participants who prefer familiar surroundings. People managing work, education, or health needs. Those seeking a wider choice of psychologists. Benefits and challenges of telehealth psychology. Telehealth psychology can improve access to support, but suitability depends on each participant's needs. Reduce travel time and transport barriers. Attend from a familiar environment. Access a wider choice of psychologists. Fit appointments around daily routines. Continue support during travel or relocation. Include support people with consent. Possible challenges include internet issues, limited privacy, and screen fatigue. When telehealth psychology may not be suitable, telehealth may not be appropriate when safety, privacy, technology, or communication needs cannot be adequately supported. No safe or private location is available. Internet or suitable technology is unreliable. An in-person assessment is required. The participant cannot engage effectively online. Communication needs cannot be accommodated. Immediate risk or crisis support is needed. What technology is needed for telehealth psychology? Most telehealth psychology appointments only require basic technology and a quiet, private space. Smartphone, tablet, laptop, or computer. Reliable internet connection. Working camera, microphone and speakers. Secure appointment link. Headphones if helpful. Device charger or stand notes, reports or communication aids. Water, sensory items, pen and paper. How to prepare for a telehealth psychology session. A little preparation can make your telehealth appointment more comfortable and focused. Test your internet, camera and microphone. Charge your device and open the link early. Choose a quiet, private space. Gather reports, questions and NDIS goals. Prepare communication aids or sensory items. Turn off distracting notifications. Ask for clarification or a break when needed. Keep the provider's contact number nearby. Privacy, consent, and confidentiality. Privacy and informed consent are important parts of every telehealth psychology session. Ask how personal information is collected and stored. Confirm who can access reports and records. Understand when information may be shared. Discuss the limits of confidentiality. Use a private room and headphones where possible. Avoid public Wi-Fi and shared appointment links. Ask what happens if the call disconnects. Telehealth psychology for children and families. Telehealth sessions for children can be adapted to their age, communication style, and sensory needs. Use games, stories, and visual activities. Practice emotional regulation and communication skills. Include short movement or screen breaks. Support routines and family goals. Involve parents or carers when appropriate. Reduce distractions and prepare familiar items. Practice agreed strategies between sessions. Keep activities short, engaging, and personalized. Telehealth psychology versus in-person psychology. Both options can provide meaningful support depending on the participant's needs, preferences, and circumstances. Telehealth offers support from home with less travel. In-person sessions provide a dedicated clinical environment. Telehealth requires reliable technology and privacy. In-person appointments may allow broader observation. Telehealth may provide greater provider choice. Some assessments may be better suited to in-person support. A blended approach may also be suitable. How to choose a telehealth psychologist. Choose a psychologist who understands your needs, goals, and preferred way of communicating. Check their Australian registration. Ask about NDIS and disability experience. Discuss communication or sensory adjustments. Confirm privacy and telehealth processes. Ask whether support people can attend. Review fees, reports, and cancellation terms. Discuss how progress will be measured. Avoid providers who guarantee outcomes. How to book a telehealth psychology appointment. Booking usually involves a simple intake and confirmation process. Contact the psychology provider. Explain who needs support. Discuss goals and communication needs. Confirm NDIS funding and plan management. Complete intake and consent forms. Review fees and service conditions. Choose an appointment time. Receive the secure telehealth link. Prepare your device and private space. Final thoughts. How effective care can help. Telehealth psychology can make support more accessible for people facing travel, mobility, or location barriers. Effective Care provides telehealth psychology services across Australia, with support tailored to each participant's communication needs, disability-related goals, and preferences. Our team can explain the intake process, discuss whether telehealth may be suitable, clarify service arrangements, and help participants access psychology support from a familiar location.